Hello, everyone. Today we will learn about MRI of the sacrum and coccyx, which is commonly known as lower spine MRI or pelvic spine MRI. The sacrum is a triangular-shaped bone located at the lower part of the spine, connecting on both sides with the pelvic bones. The coccyx, also known as the tailbone, is the small bone at the very bottom of the spine. This MRI is mainly performed for lower back pain, trauma or fall injury, suspicion of tumor or infection, and to check for congenital deformities or structural abnormalities. Patient positioning. The patient is placed in the supine position, lying on the back, entering the MRI gantry feet first. A body coil or spine coil is used. In Siemens or Philips scanners, this usually adjusts automatically. Common MRI sequences include T1-weighted sagittal and axial, T2-weighted sagittal and axial, STIR sagittal to detect marrow edema, optional post-contrast T1 FAT-SAT if infection or tumor is suspected. MRI helps to evaluate fractures or dislocations, infections such as osteomyelitis, tumors or cystic lesions. Therefore, if someone has chronic pain in the lower back or tailbone area, an MRI of the sacrum and coccyx is an essential and highly informative test.